Hello, welcome to Dr. RS channel. Today I'm going to talk about how bone can play a big role in elderly care. So as we grow older and older, our bones become more important because now we are vulnerable to fall and we can break our bone. So what happens as we grow older? When we are young, we don't pay attention. We have a strong bones. Our bone have two type of cells. One, they build the bone, and the other one, they eat up the bone. So when we are young, we have more bone builder, which is we call it osteoblast, and the bone eater cell we call osteoclast. So when in younger age we have more osteoblasts, but in older age we have more osteoclasts. So we have to fight these bone eater cell with the diet, with exercise. So what happened as we grow older and older? We kind of don't do the same kind of exercise. We also our habit of eating changes sometime. We don't pay attention to what diets are important for our bones. And in women, the hormones levels go down, like estrogen. So our bones become weaker and weaker. So when we are young, the bones are like very tight knitted. It's just like a cloth which is all kind of a very well knitted. But as we grow older, there are holes in the bone, and there is only skeleton. So we get then compression fractures in our back. The vertebrae they compress on each other. So that's where people start losing height. So every year we should measure our height. If we see any difference in our height, that means we have osteoporosis. Then there are some medications which we can actually treat the osteoporosis, where we can fight those bone eater cells. So sometime we are reaching the top shelf of our closet, and if we cannot reach there, it means that we have lost the height. That's a simple way to see whether you are losing your height or not. My mom, she was 5'8", but in last days when she was in 80s, she was close to 4 feet. So she lost so much height because she was osteoporotic, and she was bent. Her back was just like this way. So osteoporosis this disease is crippling. People cannot walk. They cannot actually be independent. They then start having problem with the digestion because the stomach is like bent like that. Then they also start having problem with incontinence. There's a lot of problems are associated with osteoporosis. So don't take this light, this disease. It can be really bad disease. So every year you should have, I shouldn't say every year, all the time you should keep an eye on your height. There are some tests which we can do in the offices. There are DEXA scan. We call it bone density. These tests are done to check how the bone mass is, how the bone density is. If there is a density is going down, there are medication which you can take one injection once a year, and that will help your bones. But before even going to that point, we have to pay attention on the diet. We have to pay attention on our supplements, vitamins, and also minerals. So what diet items I would suggest you should take it every single day. Do not miss that. And number one is milk. If you cannot tolerate milk, you can try other milk. There are other options now, almond milk, other things available in the market. Eggs are very important. Organic eggs, 2 eggs every day is must for your diet because it has a lot of minerals. Everybody knows that vitamin D and calcium are important, but there are more to it. We also need protein for our bones. We need magnesium, we need cobalt, we need hormones, especially in women. So we need more than just calcium and vitamin D, because if you're taking too much calcium, that also is not good for you. So you have to be appropriate. The dose has to be appropriate. Usually people are taking from 600 to 1200 milligram of calcium, and then also they use vitamin D. But before you pop in a lot of calcium, you need to see your doctor. You need to talk to your doctor, because it's very important. Self-medication is not that great. So again, I'm going to say how important it is to keep our bone in a good shape, because if we have osteoporotic and if our bones are not in good shape, our joints are going to be affected. We will have the big, large joints, small joints. They all are going to be affected. Exercise is extremely important for our body, because it's going to strengthen the bones. It's going to give muscles which are attached to the bone. If they are strong, they will help the bone. So exercise is extremely important. So keep an eye on your bone, keep an eye on your height, keep an eye on your diet. That's extremely important. I hope this is helpful for today.